Coming up in this episode of the Relebogile Mabotja podcast, find out how a man in his 30s suffers a stroke. We're joined by a cardiologist who gave his son sweets at the age of 5, but also we get to find out how we can all do better for ourselves. Hey everybody, welcome to another episode of the Relebogile Mabotja podcast. Don't forget to subscribe and hit the notification bell so that you can be the first to know when something has dropped. And I'm so excited for today. This is a very special episode. We are going to be talking about cardiovascular disease. There are myths around it and misinformation, and I'm so glad that today, proudly brought to you by Novartis South Africa, we will be having that discussion, not just with a person who has been through it, but also a person who treats it. So let me introduce our guest to you, Mntuwabantu Musa Sodaba. Welcome. You are a patient. Thank you so much for coming through.
Thank you for having me.
And also joining us, we have Dr Farai Dube, who refers to himself as a plumber of the heart. Cardiologist, how are you doing?
Thank you very much.
Thank you for joining us.
Thank you.
I'm going to start with you, Doctor of Hearts. Can you just share with all of us what exactly you do as a cardiologist? I think many people look at doctors as sort of one thing, but you really specialize in the space.
Okay, so I think to start off, I'm a physician.
Yes.
A physician is generally a doctor who deals with the internal organs of the body, but I super specialized in cardiology, which means I look at how the heart functions in relation to the rest of the body. And the heart being the core or the engine, like a lot of people out there think about it. They get very anxious when someone says you've got a heart condition or you've got a cardiovascular condition. So I normally deal with very anxious, not only patients, but colleagues as well.
Yes.
Because whenever my colleagues start, working on patients, be it even for a fracture, when the patient says that they've got high blood pressure or they've got diabetes, all of those conditions affect the heart. So they always want to make sure that before they proceed with any procedure, is the heart okay? So I not only deal with patients, but I also deal with very anxious colleagues who are managing patients in general. So that's what I do.
And I think we can all agree that we all are aware as the public that the heart is so critical. Can you just touch on how many years you had to study to be here? Because we know about the 7 years, and then how many years to get to where you are, especially for any young person watching that would love to do what you're doing today? So
in total, you're looking at about 17 years of study, of focused study.
Yes.
And it's a lot of work, but before you get to that stage where you are a cardiologist, you need to be exposed to everything else that's happening in the body, from pediatrics, from gynecology, from surgery. And then when you enter your specialization phase, so in this country we go for 4 years of internal medicine. And then after that 4 years of internal medicine, you are a specialist. Then you now go into cardiology. To become a general cardiologist, you have to spend at least an extra 3 years of study. And then people then develop special interests. Some people go into heart failure management.
Yes.
Some people go into electrophysiology, which is basically looking at the electricity in the heart. And some of us have gone into interventional cardiology. Basically, we are the ones that, work on the heart, specifically around atherosclerosis or coronary artery disease, where we want to make sure that those arteries are fine, the patient is healthy, because the blood supply is a critical thing when it comes to cardiovascular health is concerned. So blood supply not only to the heart, but to every part of the body. So you're looking at blood supply to the brain is very important. Blood supply to the kidneys, to the legs is very important. And for that, you need to have a very strong pump, if I may say, which is the heart. But you also want to make sure that those arteries are also healthy as well. So that's why we work with, teams, various teams of vascular surgeons and even our colleagues in the emergency departments as well. Because a lot of the work that we do is very critical in terms of time. So when a person presents to the hospital and they've got signs that there might be a problem with an artery going to the brain or an artery around the heart, time is of the essence.
And I'm so glad you're saying that, because we all know with so much misinformation out there, this is the man who is telling us exactly what is up. But I want to come to you, Mntuwabantu. I mean, colloquially, they'll refer to cardiovascular disease as heart failure. Chat to us about, what was your health like when you were growing up? Would you consider yourself a healthy kid?
Yeah, a very healthy kid, very active, very sporty. Played first team rugby at some point.
Oh!
Did a bit of running.
Yes.
It's pretty fast. Probably been a Springbok had I been a little bit bigger.
Yes.
I'm joking. But
generally
very healthy kid, very sporty, very active, like being outdoors. So I don't think I would have classified myself as someone who had a predisposition to a heart condition or cardiovascular disease. So in the lead up to me getting ill, work pressure was at an unbelievably high level. At the age of 33, I suffered a stroke.
Wait, so things were absolutely normal, in inverted commas, with your health from what you understood?
Absolutely.
Work pressure, which is something that many people are dealing with because it comes with other pressures, financial pressure, and. So what happened in that build-up? Was it something that felt like it came out of nowhere, or you started feeling some type of way before having a stroke? Yeah,
no, it wasn't coming out of nowhere. So I was double-hatting. I mean, I was doing two people's jobs at the same time from January to when I got sick in July. So my line manager had resigned, so I've been double-hatting, doing that job and my job. So in the week or two leading up to me getting sick, it was quite normal for me to leave work at 2:30 in the morning and be back at 9 o'clock. And on weekends, it was in a sitting. I would sit. I remember this one particular episode. I sat through the afternoon. I think I've gone through a bottle of wine or two in a sitting. So a sitting could be a span of about 2 to 3 hours. Similarly with the liquor, whiskies. So I was that in terms of coping with what I was dealing with. I tried to get myself out of it. By that I mean find a new job. It was all lined up, moving cities. That fell through right at the end. But in a way, I'm grateful that did happen, because I'm not sitting here today if I'd escaped it, and I'm not able to share my story and my testimony.
So talk us through, you referred to getting sick. So what specifically happened in that period of your life where it sounds like you were extremely burnt out, and I'm sure doctor can mention other things you were probably going through, but what specifically happened?
So the morning of 29 July 2018, Sunday morning, I woke up, went to bed, I went to the bathroom. No sooner had I finished my business in the bathroom, I collapsed on the bathroom floor. Luckily, I didn't hit my head. I have not vague recollections of it, but I seem to remember myself lying on my right-hand side. But I recently saw a picture of me lying face first on the floor in the bathroom. Thankfully, it happened at home. Thankfully, my wife at the time was there. And we rushed to the hospital. I was within the hospital within an hour. After calling for an ambulance, it took like 10 minutes for anyone to answer the phone. So we drove to the hospital. I was held by the security from the complex, hopped up in the back seat of my car, and we drove like mad people to the hospital.
So this diagnosis specifically was a stroke?
Yes.
I suffered a stroke, yes.
So then let me ask you and pause for a second here, doctor, because obviously we are speaking specifically around cardiovascular disease, right? If a person does have a stroke, do they become more susceptible to heart conditions after the fact? And is this in any way related to any kind of heart condition?
Okay, so cardiovascular disease is basically conditions of the heart and strokes. There is a relationship, a direct relationship. Like I mentioned earlier that, as cardiovascular, physicians or doctors, we are interested in the function of not only the heart, but the blood vessel or the vasculature everywhere in the body. So if there's a problem in the brain, like what happened with him, where he had a stroke, we are interested, in as far as what is the state of the heart itself, which is the main pump. But why did this young individual who was, playing sport, who was very active and probably going to the gym and, eating well, why did he have a stroke? And the one thing that he mentioned was that he was going through a hectic, phase in his life. And a lot of us go through these hectic phases. And when you start, talking about stroke, the general consensus out there is that it's your 60-year-olds or
they think it's for older people. Yes.
But now we have a young, gentleman who is healthy, in all means. By all means, by most definitions out there, he's healthy, but he gets a stroke. And that's where we now come in and we say, but what happened to this young man? Let's explore and let's, go back to the basics. And yes, like he said, he was doing the right things. He was exercising, in his sporting career or school career. He was fine. Then, life happens. And a lot of us go through these, life stages where we are hectic at work. We are not exercising as much. We end up developing, coping habits. And there are some things that he has mentioned now, about his coping habits, which to some extent will, escalate or, predispose us more to, cardiovascular events, so to say.
Because they start to contribute, obviously, to the state of the body. Yes. We know that alcohol, while it can be a coping mechanism, is not necessarily one that doctors recommend. If you're those people who say the doctor said I must drink 2 glasses of red wine a day, not true. But just in terms of, for a moment, on your side, when you collapsed, what specifically were you feeling in your body? Is it like you blacked out and then you woke up on the floor? Were you feeling that you couldn't move certain parts of your body? I think it's important that we remind people what are some of those symptoms, even though, Doctor, you'll reiterate that they're not always the same in everybody. But how did you experience it?
I slipped. I thought I slipped and I fell. I was quite conscious. I didn't black out or anything. I was quite awake and aware what was going on, and that I was on the floor. And I was communicative, but as I'm told, that one side of my face had collapsed. Symptoms of a stroke.
Were you in pain?
No, I was of the view that it was a fall. I'd get up and then we continue with the life, but I couldn't get up. Obviously, the one side, about half of the body is paralyzed essentially, so I couldn't move. So in trying to get up, I'd stumble and fall. And that was quite discontented, so I just lay there waiting for help.
Did you immediately register that, I think I'm having a stroke, or was it later
No, it was only when I got to the hospital that I realized what was happening. But also after I came to, because I was put under, given some medication to sort of dissolve the clot in the brain. That's when I realized what was happening, having consulted with the doctors and been given the update as to what was happening. But at the time, I absolutely didn't know what was wrong.
Doctor, I've interviewed and had discussions with many people who have had a stroke. Some just felt a slight, was that a headache, and then kept it moving. For others, it is a lot more dramatic with extreme pain. What are some of those symptoms that patients should look out for?
I think for me, it's sudden loss of function. You know, some people become a bit confused. Some, you know, when you look at the face, they might have weakness on one side of the face, weakness on one side of the body, tingling sensations. Some people just collapse. You know, they collapse, and then when they try and get up, they can feel that they can't use one leg or, one limb. And I think coming back to him, where he collapsed and he wasn't, sure what was happening, but they activated the emergency care system quite early, which is very important because there's a window of opportunity where, as healthcare practitioners, we can intervene to limit the amount of damage that will happen to that specific organ. In his case, at the time, it was the brain. So within 4 hours, if you're feeling, these funny sensations, like someone who was, coherent, and all of a sudden they are becoming, very confused, and they haven't taken any of these intoxicants or anything like that, then people must think that there is something wrong with this individual. We need to, quickly take them to be examined by a healthcare practitioner, even if it's a nurse, who can identify what is happening. So a lot of our emergency care services have got, stroke teams that are, available, which I'm part of. There are, myocardial infarction or heart attack, response teams, which, we are also part of. And we make decisions, based on even a phone call. When someone says, I've got chest pain, and this pain is not going away, and I've got a history of high blood pressure, or diabetes, and so on. And then when you ask, can you explain to me what is the nature of this pain? And then they explain to you over the phone, then people can be told, please take an aspirin, or, quickly go to your nearest clinic, and then they can give you, some medication, because cardiovascular disease, as far as we are concerned, is responsible for the majority of premature deaths. When we're looking at individuals under the age of 65, premature death and premature disability. So disability in the form of a stroke that is not taken care of in time leads to, disability, rehabilitation. A heart attack that is not taken care of in time will lead to disability. And those under the age of 65 are supposed to be contributing to the economy. They're supposed to be working, not being rehabilitated. And for him, he's been very fortunate in that he went through that whole rehabilitation process with our teams, and he's now, back out there working, and he's taking the necessary precautions in as far as, taking care of his heart and his health is concerned.
You have obviously spoken about some of the signs that the other people in the room should look out for. You've touched on the fact that it can leave a person with disabilities, like now having speech impediments, no longer having types of paralysis as well. What are the more extreme cases? And I know you touched on death, but I just want us to really emphasize the importance of seeking medical attention. I know of many people who don't like going to doctors or hospitals, and they will try and brush away, the urgency. They might be like, no, in the case of yourself, it could have been like, no, I just fell, let's let it pass, or I'm feeling pain in my chest, but it could just be a panic attack, because that does sometimes happen where people rush to the emergency room and they say it's not a heart attack, it was just a severe panic attack. Can you just really stress and emphasize for us that it's better to be safe than sorry, and have a doctor say you're fine, then you decide for yourself, I don't even need to go to the doctor?
So one of our principles in cardiovascular medicine is time is muscle when it comes to the heart. So it means that if you have chest pain, and this pain is coming from the heart because of a blocked artery, the longer it takes for us to unblock that artery, the more damage that heart is going to have. The more muscle is going to be destroyed. And what does more muscle, destroyed, translates to? It translates to an individual who was, able to run a marathon, for example, who's now not able to get out of bed without being short of breath. It translates to an individual who had a heart that was pumping at least 60% of what's coming in, to a heart that's now pumping out sometimes as low as less than 20%. And that less than 20%, it takes years to rehabilitate that individual. It takes years and money as well, because from a cardiovascular intervention perspective, there's a lot more that we can do these days in terms of, there are very good medications out there. There are very good, devices out there which can help individuals. And there are very good rehabilitation programs out there. So if the individual doesn't respond in time, then you must be prepared to go through the rehabilitation. That is, if it doesn't kill you, you see. And from a stroke perspective, yes, a lot of people, have strokes when they are still young, and we are able to rehabilitate them to an extent where they are fully functional and, go back into employment as such. Okay.
What was your recovery journey like, just in terms of, what did the doctors share with you in your particular case once you got your diagnosis?
Yeah, the recovery journey, I like to think, is still ongoing. And it rests on two things, right? Access to great medical care, but also spirituality and faith. On arrival at the hospital, I was received by a Sister Martha, a prayer warrior in her own right.
Yes.
Very funny character as well. I love to be around her. And Dr Dube, these are people that my mom would say, and later on a phone call, she describes them as God-fearing somebodies. So my mom is a Bantu education product, so she speaks like that. So I was received by these individuals. So I think patient care is critical. I think in my ward, when I arrived at the hospital, the NICU, it's difficult to develop a connection with your patients, because I think your days are pretty much numbered when you're there. You're like 5 to departure, you're going. So it's difficult for people to form that relationship. But I think it's critical. It's a critical part of the care. One of the things Sister Martha shared with me was a visit by my nieces. They came and they said a prayer. And Sister Martha's words were, on that day I felt the Spirit of the Lord in this ward. That touched me to a degree, but as we all are, when we think we're bulletproof, we don't do much about it. It's like, oh, okay, whatever, But that whole process was always triggering. I had colleagues praying for me that only heard about the story in passages and coffee machines. They said prayers for me. I'm here today to share the testimony that it is possible. Obviously, exercise as well gives yourself a good chance of recovery or being well. Do things in moderation. You don't need to be extreme about anything. Eat in moderation, exercise in moderation, enough to break a sweat. Spend time with people that you love, because time is absolutely no guarantee. So blending that access to medical care, and I don't think it should be a privilege, it should be a right in this country, but it's not at this point. It's a privilege, and you sit and you ask yourself, why me? Particularly when the bad things happen, you ask, why did this happen to me? But also the same question needs to be asked when you're recovering. Why you? Because I have no better claim to being alive than any other patient who's gone through this.
Look, and we're so grateful that you are alive and able to share your story, because you also speak for those that did not make it, having gone through it. Dr. Mntuwabantu has touched on some of the lifestyle adjustments that can really assist, not just from a recovery perspective, but even a preventative perspective. Can you chat to us about why they're so important and what you recommend?
So, the one thing that he mentioned is, previous exercise, previous lifestyles. And what I want to say is that everything that we do in our lives has got a legacy effect. And what do I mean by that? Growing up as a child, if you were a sporty child, you are investing into your 50s and 60s. From a personal experience, I have a 14-year-old son now, whom when he was born, we made a conscious decision as a family that we are not going to give this child any form of sugar. And then I made the mistake when he was 5, and I introduced him to
We
sugar.
don't blame you. Sometimes the sugar is all you got to give the child.
And then that, led to a journey where we, when he was now in school, there were concerns about his, activity levels and so on. And these are journeys that, a lot of parents, go through, where you now have a child who's very active and so on, and you then take this child to a healthcare professional saying, no, this is attention deficit and so on.
Yes.
And the knee-jerk reaction there is we want to medicate this child.
Yes.
And that's where it starts, I think. But then we say to ourselves, no, we are not going to medicate this child. We are going to change the way we eat in this house. And it's a very difficult journey, because when you look out there, a lot of us are taking a lot of sugar. We take in a lot of, let me say, fat. If you look at obesity levels in as far as our school-going, children is concerned, we have a very big problem in this country because of obesity, lack of activity. So which means these kids are not investing into their future. And also when we talk about activity levels, the iPads, the cell phones, some of us, when we grew up, we used to be told, go out and play,
Oh, the good old days when you'd get chased out the house and you're forced to be in the trees, and then we were forced to finish our vegetables.
Exactly.
Right? Yeah.
You see? But nowadays, the kids that are being, raised today, maybe because of security reasons and so on, the child is on the iPad, the child is on the phone, they are not free to go out and play, to climb the trees. So all of that physical activity or investment into their future is being lost.
But I think what's so great about what you're also saying about the physical activity is we need to remember about the heart being a muscle.
Exactly.
And the only way that a muscle is going to be at its best, and you will know, having been a rugby player, is to exercise it.
Yes.
So to keep it moving, and in the case of this, to keep it pumping.
Yes.
Just in terms of what you could have done differently, now that you look back on where you've been, what would you have done differently had you had that foresight to say, oh, something might be coming? And it doesn't necessarily have to be, I would have kept exercising, like anything that maybe you can share with us that you would have done differently.
I think crying for help early on when the work pressure was too much. Put your hand up and say, I can't cope with this. It's not sustainable. Leaving work at this hours every day. It's not on. So asking for help, delegating more. But I think also being sensitive in general, guarded about your time.
Yes.
If I look back now, the things I do, I don't work at home. I try not to open the laptop when I get home. I try and avoid it as much as possible, and being selfish about that. So I think I could have done a bit of more of that as well, had I known.
Yes.
Yeah.
Can we talk briefly about alcohol and why it might not be such a positive thing? And the reason I think it's so important to pause, so many people are, it's either they're dealing with work pressures or they're dealing with not having work. And that is what their coping mechanism is. It can start as 1 glass a day and then it becomes 2 bottles a day. Why is it so bad for the heart health in particular?
So there is a phenomena or a condition called alcohol-related, cardiomyopathy.
Yes.
Where basically the heart muscle weakens because someone is consuming alcohol. And we see a lot of those cases. So I'm only talking about the one organ, which is the heart.
Yes.
Besides its effects on the brain, its effects on the liver, and also its effect on young people. If you remember, during COVID, it was illegal, to consume alcohol. And what happened to our emergency departments? They were empty. Because the number of accidents, the number of fights with stabbings, so the trauma levels in the country literally, came down to zero. I trained in Chris in Paraguanath, and every Friday we used to know that the emergency unit would be full because of accidents, stabbings, shootings.
All alcohol-related cases.
All alcohol-related cases.
And of course, we also don't dismiss any other kind of substance abuse.
Exactly. Yes.
And that includes prescription medication as well, which we know is sometimes abused as well. Just from your side, what advice would you give to young people, especially those who are in the position, everybody's just trying to do their best, provide for their families. You touched on one of them, which was like ask for help. I'm one of those people who struggles to ask for help. You say you're going to push through, but what other advice can you give now that you also consider yourself still in recovery, so you're hyper aware?
I'd say do things in moderation, whatever it is that you do, whether it's exercise, whether it's work. Also work in moderation, do your hours. Don't try and be a hero. Corporate will show you are nothing more than the job number that will replace you. So don't overly exert yourself unnecessarily.
Did they replace you while you were in recovery?
They tried. They made me sign some forms to say this man is going to go. It's a sad story in its own right, but I think there are genuine people out there who have your back. So put your hand up and ask for help. Was
that a wake-up call for you, this whole experience?
Yeah, it was. I think when you're going through it, you as we all do when we're going through difficulty, you do your own negotiations with the Lord or your Maker, and you make all sorts of promises, but you hardly ever live up to them. But I think it's been a seminal moment for me in terms of my own spiritual journey as well.
Yes.
So that's created a bit of an awakening. I'm not suggesting to you that I'm holier than thou or I'm very much a sinner, but I'm finding my way in my own special way.
I think I would call it you found a newfound respect for your life.
Absolutely. Absolutely.
Doctor, as we come to the close of our conversation, what insights can you share with all of us, particularly when it comes to heart health, heart disease, cardiovascular disease, that maybe we also don't know, and we don't need to have what has happened to yourself for us to even need to have these types of conversations?
So I think, the one thing that I'd like to urge, everyone out there is that people must know their numbers. What do I mean about know your numbers? You must know what your blood pressure is. A lot of us have got this misconception that blood pressure or high blood pressure is for the elderly. We are picking
because
up...
they call it high.
Exactly.
But it's for all of us.
It's for all of us. So blood pressure is very important to know, even when you are a teenager, because there are a lot of teenagers that have got high blood pressure out there who are running into trouble in their 30s and 40s with strokes, heart attacks. People need to know what their cholesterol is. Now, cholesterol speaks to what we take in on a normal basis in terms of our diet. If you look at the transition that we've made from the days where we used to grow our own vegetables, we used to have our own, meat red in the garden and so on. Now we are eating a lot of fat, okay?
Fast food.
In fast foods. And we're eating a lot of salt as well. In all of these processed foods, there is a lot of hidden salt. I have a lot of patients whom, when we have this conversation about diet, and I say to them, so what do you say about your diet? And I eat a very, good diet. I think we are good. We eat vegetables and salads, drink lots of water and so on. But then when I do the blood test is going, tells me a different story. And then we have the discussion about lifestyle changes, which is now the stress management, which is very, very, very important in this day and age. Mental health is, in the fore, because in the past we never really used to, talk about it. People say, no, you must be tough as a man. You must be strong, you must take it in. Even within the profession, we are now having, a crisis where, colleagues are burnt out because they can't take the pressure. And we are having those, conversations. And it's something that, as communities, we need to talk about, the corporate ladder, climbing that corporate ladder, and the stresses that, come with that. And the, toxic environments that, people end up. And I see a lot of those, people in these toxic environments. So things like sugar is very important, diabetes. There are a lot of people who are undiagnosed when it comes to diabetes out there. Already, if I tell you that because of obesity and blood pressure, the World Health Organization is saying that by 2030 there is going to be a crisis in the world because of these non-communicable diseases, which are the lifestyle diseases, which speak to the numbers that I'm talking about. Your blood pressure, your sugar, your cholesterol, your activity levels. Right now we have some of our, our healthcare, funders who are saying to us, no, you must walk so many steps a day. Just to get people to start walking.
And give the incentives.
Yes. So, and I, fortunately work with some, elderly or retired groups of women who have, exercise, classes in the morning in Soweto. And I also have, patients in my practice who are over 100, and when you sit down with them and you ask them the question, but what is the secret? And it's basic things. It's exercise, eating well, having a happy life. You know, they will say to you, you know, I had a happy life, which means I was not stressed in my life. And unfortunately, the kids that we are rearing these days, because of social media and the inactivity, they are already stressed in their teens. You know, a lot of these kids are committing suicide and so on. So for me, really, it's about going back to the basics.
And I have to ask a question. I know that we're speaking to a gentleman, but in terms of cardiovascular disease, it affects both men and women, so we can just stress that to be the case. Is there a way that a person can go and get tested to see if they are more susceptible, or should they maybe look at their parents' medical history and possibly take that into consideration?
So those are the conversations that we need to have in our households. You know, those are, in some families, they know that uncle so-and-so had cancer. This other uncle died of HIV. You know, people talk about, you know, HIV freely. And to put it into context, in South Africa, HIV and its related complications is the #1 killer, you know, in this country. And then cardiovascular disease is #2. But how much in terms of awareness, you know, have we invested when it comes to cardiovascular disease? And yet it is the #2 killer in this country. If I say to you that every day there are about 200 to 250 people that are dying from cardiovascular disease in this country every single day. So the conversation that we're having now is very important in getting the message out there, because when it comes to HIV, there's been a lot of investment from, you know, the government perspective. We have demystified, HIV, and which is what I think we are, doing when it comes to cardiovascular disease, because a lot of people think, no, heart attacks, strokes, 60-year-olds, when someone is about to die, they will die from a heart attack. And yet we are having young, people, and even much younger people, getting these conditions. So the conversation in the home is very important, I think. Then if you take it out into the school environment as well, there are various campaigns, that, the schools can have. I know the Department of Health also has got programs around lifestyle diseases, but those programs, are run in a specific month, on a specific day. There is hype, there are cameras, and then everything just fizzles
out.
Yes.
Especially on the awareness months.
Exactly.
And I think what we're doing today, I think, is the beginning of even more conversations.
Yeah.
And I thank you both so much for you sharing your own personal experience and just being vulnerable to also the reality of how you were not coping, which you're not supposed to cope in a situation like that. And to you, Doctor, just for giving us all of this information, this awareness, and stressing the importance of the conversations and just the lifestyle changes, knowing your numbers. And now it's so easy, you can just pop into any of your local pharmacies and get all of these things tested. Thank you so much again, gentlemen, for coming to chat to us. Thank you so much to all of you for tuning in. It brings us to the end of this episode, but the very beginning of important conversations in your homes. Know your numbers, find out about your family history, and don't forget, this will never constitute medical advice for you. Make sure you consult a professional so that you can be treated specifically for your particular case. But let us all get well and be well together, and I look forward to sharing more of these kinds of conversations with all of you on the Relebogile Mabotja podcast. Comment down below with your questions. Let's see if we can get Doctor to answer them. Subscribe and hit the notification bell as well. Till next time.